I'm Dr. Kelsey Dalton. I have been working with Woodlot Companions for probably close to 5 to 6 years now. I come um, anywhere from once a week to every other week, and during those visits, we check puppies. We do physical exams. We call them white health papers, but they pretty much do a physical exam on the puppy, and we go from head to toe, checking eyes, ears, mouth, skin, limbs. Um, we check umbilical hernias, four hernias, um, female versus male, any congenital abnormalities or issues that day. So making sure they're healthy, no respiratory conditions, anything along those lines. At those visits, we also do routine wellness on their adult dogs. That would include full physical exams, and this at Woodlot Companions, we also do annual blood work to check for contagious diseases and routine screening for heartworm disease. We'll collect fecals and do general wellness fecal checks on the adults as well. For our puppy physical exams, we go through what we call white health paper, and on the paper it's a 19-point check. It's 17 points for each individual puppy, depending if it's male or female. So what we'll start with is my personal physical exam. I start with heart, check for murmurs, arrhythmias, and then I will go to lungs, check for any increased noise that would be an indication of an infection. Then I go to skin and kind of go across the puppy's back, make sure there's no abnormalities there or external parasites. I'll move my way to the head and check ears, make sure there's no infection, no infection in the ears, or they can't actually get external parasites in their ears as well. We check the screen for that. I go across the eyes, make sure there's no abnormalities within the eyelids themselves or on across the surface of the eye. Move to the nose, make sure there's no discharge. Then the mouth, no cleft abnormalities. Go inside the mouth, check for an underbite, overbite, or the roof of their mouth for a cleft there as well. I then rotate the puppy over and I'll check their belly for any hernia abnormalities at the umbilicus or their inguinal area. This is a female puppy, so I would check her for a redundant, or other term is hooded vulva, and then I check their knees and hips for luxating patellas or any abnormalities or pain on hip palpation. That is general overview, and then the last thing would just be body condition score. Make sure they're growing at an appropriate rate.